Why were amputations common in WW1 medical care? Imagine being caught in the chaos of a battlefield where injuries are everywhere and medical help is miles away. That was the reality during World War I. Soldiers faced injuries from artillery shells, shrapnel, and bullets that caused terrible damage to bones and soft tissues. Many wounds were deep and shattered bones into pieces, making it impossible to repair. The muddy trenches and manure-filled surroundings meant infections like gas gangrene spread rapidly. This bacterial infection could kill a soldier within days if not treated quickly. Medical teams working near the front lines had limited tools and medicines. They often used basic anesthesia and sterilization methods. Because of the chaos and limited resources, surgeons had to act fast. If a limb was badly damaged and infected, removing it was often the only way to stop the infection from spreading. About 40% of wounds involving bones in the limbs ended with amputation. There were few options to save the limb or fight infection at that time. Antibiotics, which could fight bacterial infections, were not yet available. Without them, once infection set in, the chances of saving the soldier's life dropped sharply. Surgeons had to make quick decisions. They often removed large sections of bone or entire limbs to prevent death. These surgeries were performed in rough conditions, sometimes called the chopping block or the butcher's kitchen. Despite the risks, amputation saved many lives. The high rate of amputations also came from the fact that medical knowledge and technology were still developing. Surgeons had limited training and equipment. They relied on their experience and quick judgment. Even with all this, the mortality rate during amputations was high. About 1/3 of soldiers who underwent surgery died on the operating table. In the end, amputations became a common response because injuries were so severe and infections so deadly. Medical teams had no better way to stop infections or save lives under those extreme conditions. While harsh, this approach was often the best option available to give soldiers a chance to survive.